The transformation in patients with MPN is really leads to a dire situation. In general, outcomes are not good. There are, some small segment of patients who will benefit from conventional chemotherapies that we use to treat acute leukemia if it is followed by an allogeneic stem cell transplant. So some of these patients are curable, but it is the minority of patients, unfortunately. What we've known for a number of years is that intensive chemotherapy doesn't seem to help these patients unless it's followed by a stem cell transplant. More recently, there have been a number of investigations centering on hypomethylating agent therapy. So either hypomethylating agents alone in combination with Ruxolitinib or in combination most recently with Venetoclax. There have been a couple of papers published recently and within the past year about the Venetoclax-based regimens for these patients. And what the data shows is that if you look at the median survival in people who are treated with hypomethylating agent Venetoclax, hypomethylating agent Ruxolitinib, or even to some degree hypomethylating agents by themselves, there doesn't really seem to be a clear difference in overall survival. If you look at the remission rates, they do seem to be, trend higher with Venetoclax-based regimens. They're sort of in the 40 to 50% range. But I think the message is the same as with intensive chemotherapy, which is that if you aren't going to consolidate patients with a stem cell transplant, then it might not be worth taking the risk of using a Venetoclax-based regimen because it does come with a risk of infection and bleeding. So the high-level answer here is we need to find better solutions for this problem. What we have currently is not working well. There are some bright spots in the sense that about 20% of these patients have an IDH1 or 2 mutation, and in fact, there is some reasonable data that IDH2 inhibitors can have a good response in terms of both remission rate and the survival of the patients. I mean, the numbers are very small from the published data so far, but it's an encouraging sign in that IDH inhibitors are being studied in combination with Ruxolitinib currently for patients with IDH2 mutant disease. So there are some opportunities here, but we certainly need to do better.